Hello, welcome to this module on community resources. My name is Mark Harris. In this module, we'll cover the learning objectives shown on the screen. We'll describe what community resources are and their role in preventing and managing chronic disease. We'll talk about how you can identify community resources and how to know that they're of appropriate quality and for use in medical practice. And so at the end of the module, you should be able to support people with chronic disease to access the community services and programs they need. Why are community resources important? Community resources and are activities and programs that are outside of the health system. They're important because they can help people manage their illness. They can help reduce the impact that illness has on their lives and improve their quality of life. There are a number of sources of information about community resources. Local councils, local government has directories of services that are available in their area. These are often extensive lists of various programs and organisations providing local services that may be relevant to patients. Primary health networks also have a directory of community organisations and services. Some non-government organisations concerned with specific conditions also provide information on state and local programs and services. For example, Diabetes Australia, the National Heart Foundation, all of them have information on local activities and programs. Migrant resource centres are also very important sources of information about local programs and local organisations, especially for different language and cultural groups. And lastly, community and religious organisations can be important sources of support and programs and services for local people. So how do we assess community resources? We need to think about the sort of information we need to know about them so that we can talk to patients about them. First of all, of course, we need to know what sort of activities or services they provide. Are there any restrictions? Who's able to use them? They may be, for example, only for women or only for men or only for people with certain sorts of problems. How do you go about arranging access to those services? Is there a callback? If you ring and leave a message, will they call you back? How long is the program or service that they provide? Usually they might provide an activity or a program for a number of weeks or months. So how long does that go on for? And are there specific requirements for people to participate? Do they have to have dress or bring certain things with them when they come? Does the organisation have an agenda? They may have a commercial agenda, so they may be important to think about that, and especially in terms of what it might cost. There may be a religious agenda, so they may be wanting to promote their religion to people through the service. Are there issues with transport or parking getting there? What about language? Do they have arrangements in different languages, interpreters, translated materials? And how long do people have to wait, both to attend the service, but when they get there, is there a waiting time once they get there? So all this information is really useful information to get so that you can share that with patients. So navigating community resources starts with knowing what exists and finding some useful resources and then understanding how to access those resources and to overcome barriers to access which individual patients might have. It's often as we work with patients to access those programs or services that we need to really discuss with the patient about what barriers they might experience, which could be transport or could be concerns about cost or how appropriate the program is going to be for them. So now you'll be able to take the quiz. In addition to the notes and these slides, there's a quiz which will ask you some questions about community resources.